Hi everyone. I wish you all a very happy World Occupational Therapy Day. And first of all, I would like to thank you, IOTA, All India Occupational Therapy Association, for giving me this opportunity to come and speak to you all. And I'm really delighted to connect with you all on this big day when we celebrate occupation and our identity as an occupational therapist. So, the topic for today's presentation is future of healthcare and how can occupational therapy help. Initially, when I was asked to do this presentation, I was thinking, should I talk about future of occupational therapy, or should I talk about future of healthcare, where is it going, and then add how occupational therapy can be part of that future. So I decided to talk about healthcare and then talk about how occupational therapy fits in that scheme of thing. And there was a time, in past, in 30s and 40s, when a good healthcare was anything you provide free of cost. So basically, anything you provide free of cost to public becomes a good healthcare. So that was the parameter to measure an effective healthcare in 90s, 30s, and 40s. As we moved on, the focus shifted to prevention space, and people were talking about how to do effective sanitation, maintain cleanliness to avoid infection and communicable diseases. There was a lot of emphasis on prevention side of things in 1940s and 50s, and gradually we came into 90s when we were talking about evidence-based practice. And you would be aware that nursing was the first profession who talked about evidence-based practice. And from there, that idea flowed into the medical field, physicians and surgeons talking about evidence-based practice. And then it came in other professions like occupational therapy. Now, where are we going? So from 90s, when we were talking about evidence-based, and there were big events on evidence-based practice, and people were talking about what is the significance of having evidence in practice. But gradually we came in 2001 and in early 2000 when the discussion shifted to how to deliver more with less. And basically the whole idea of lean approach or lean management, how to deliver more with less resources. And this is a common concern with many countries around the world are grappling with. They're struggling to find health solutions with limited budget, money, or resources they have. When we came to late 2000 and now in recent time, we have been talking about, yes, evidence is there, and there is evidence to do so many things, but with what we have got, how effectively we can provide services which get valued by consumers. And when I say consumer, it basically means patients or people who consume health services. And I would like you to pay attention on the two aspects of value. Values is from moral point of view, what do you want out of health services? So for example, when you enter a hospital or a health system premise, what do you expect from health professionals? And a few things you may look for is the doctor smiling? And tell me how many of you would go to a therapist who smiles and greets you and welcomes you uh, to his or her clinic, or would you prefer going to someone who who sits like a grumpy person and rarely gives a smile. And so these are the values. What are the things which you value? And other things to value would be, what do you want to get out of an intervention? So this is a story about, and this is not my story, one of a well-known clinician who, his name is Sir Moore Gray. He gives an example when a person goes to a surgeon and says, I want to get my knee replaced, right? And the surgeon says, okay, why do you want to get your knees replaced? And he says, well, I cannot do gardening. So this person did lots of gardening, so he sits there, basically squats, and then he does gardening. And he was finding difficult because of his osteoarthritis. He was unable to do it. Now the surgeon said that, do you realize that if I'll operate your knee, you will not be able to do gardening your entire life? Because with the new knee joints, you will not be able to squat. Well, in this case, there's so many evidence around knee replacement. We know that knee replacement works, but in this scenario, it will not serve the purpose or will not serve the value which the patient or the consumer wants to have out of it. And probably that person walked out and went to someone like you and me, an occupational therapist, and you can do adaptations to maybe arise that planting surface, have a planting pot or something on a table where you can do your gardening. So there are ways which you can provide your services and meet the value of your consumer. The other aspect to look for is, what is the value add of what you're doing? And when we think about value add, and I know still in many parts of the world, we still focus on one individual specialist based treatment approach. But where we are heading in future, it is more about how you can work as a system, and they call it complex adaptive system. And just like how honeybee produce honey, it's like a teamwork. Various people, various honeybee, they are there in that beehive, and they all are doing different kinds of work. There is a queen and there are workers, and there is a division of labor, and they all work in coordination in a complex adaptive system to deliver an output. And what is that in this case? Honey, that sweet thing which you and me enjoy to eat. It's delicious, isn't it? Now, similarly, in healthcare, the future is going towards health systems approach, where not one or two person or profession will decide how the intervention will look like. It's about different professional groups and also different services. For example, what I do at the moment is that I manage a program which is cross-agency for the Ministry of Health in New Zealand. And the program is around managing fetal alcohol spectrum disorder action plan. So I have to work closely with health, police, corrections, that is the prisons, youth justice, remand homes, Ministry of Primary Industries, Ministry of Education. So all these different government departments, they work in coordination in a complex adaptive system. And our goal is one, that is to provide support for people affected by fetal alcohol spectrum disorder. And that is where we are moving in future. So as occupational therapists, you and me have to look at how we can fit as part of that system and work in collaboration in a complex adaptive system with other professionals which may or may not be sitting in health. Now, on this note, I would like to talk about the transformation which has been going on in different agencies. Now, tell me, well, I was in New Delhi a few years back, that was back in 2010. I had never imagined that one day I'll be able to use my smartphone to book a taxi, something like Uber or Ola. Believe me, did you ever imagine in early 2000 or 90s that you will be able to book a taxi by just pressing a button? Or did you ever imagine that you will be able to book hotels or places to live by Airbnb? So there has been a revolution, there has been a transformation in many health industries. And Ola, Uber, Netflix, all these are examples of this. There is a very good book written by Sangeet Chaudhary is the name of that person. It's called Health. It's called Platform Revolution, and I would highly recommend you all to go and get hold of that book. And it talks about how Amazon and Ola and Uber, Netflix, all these companies have transformed the way in which they provide their services. I'll give you one example here with Singapore Post. Now, Singapore Post in early 2000 was going through a big change, and their worry was how they will compete with the overgrowing demand of internet. So people were not using letters, they were not sending parcels to each other, and they were losing business. Now, this was the time then many postal services around the globe were struggling, but Singapore Post really used it as an advantage and flourished. So, what they did is that they changed the product. So, initially, they were providing services, delivery services like any postal services do. But Singapore Post, they change their outcome, the delivery, the outcome of the product which they give. Now they started to provide operational or supply chain facilities along with delivery. And as a result, their business started to go really high and they were doing really well. Similarly with Netflix. Originally, Netflix started as a video company. You remember those old VCR and VCP days, and some of you who were born during 90s or even before that would remember that. Not the young ones. You would not remember those VCR and VCDs. But Now that is how Netflix started. And now see what they're doing. Now they're using platform to deliver their services. At the same time, they're also producing their own um, programs and web series and all these new entertainment web series and so you are looking at how Netflix has transformed how they deliver services. Similarly, this transformation is going to happen in healthcare, and it will happen today or tomorrow. As occupational therapist, you have to think about going in future how you want to provide something which fits in the system, which serves the purpose of the delivery of healthcare, at the same time meets what gets valued by the consumers, and also something which can give you access to this market. And the history of occupational therapy, suggests us that whenever there is a crisis, there is an opportunity. Whether it was World War One or World War Two, whenever there was a crisis, something new came up. Basically, occupational therapy as a profession got established mainly after World War Two. COVID-19 is a crisis, and this is I'm leaving a challenge for you how you can use this crisis as a leverage for future, how you can build up on this so that you can deliver something which gets valued by your consumer. And it can be doing things in the well-being space. So not just looking at curing or providing services for conditions and disorders, but also looking at what you can do in well-being space. And there is a lot you can do. and lots of inventions are happening in the field of artificial intelligence. And recently, UK, they released their first strategy on precision medicine, genomics. And in simple way, they're looking at things that can you do gene editing to treat some of the conditions. So the healthcare is moving towards more individualized care, caring and providing services which is fit for individuals. And as occupational therapist, you have to look at where do you fit in that. How can you use the leverage, especially of this COVID-19 crisis, to to position your business in a way that you get something good out for you and also for your consumers and the citizens of your country who are going to benefit from it. So this is quite a short presentation, and I wish I had a few more minutes or hours even. But hey, look, I'm more than happy for you to contact me, and your association would be able to provide my contact details to you, and we can keep this conversation going. Enjoy the day, be proud of what you do as an occupational therapist, and you are one of the leaders of healthcare. Be proud of yourself and make your country proud by doing what you do. All the best.